This is a partially scientific and partially non-scientific topic. So we have human body, as we have understood in all these years, is a very great wonder, and a key to a meaningful life probably is a pursuit, trying to understand the why, what, where, how of it, and surrender to the great unknown. As we spend hours and hours reading and working and doing nothing else also, you don't understand even a fraction of what this system is. So therefore, like-minded persons can in this platform try and share our experience. That's what I'm saying. So Arjuna asked once Krishna, this is a question we all of us ask. So when students want to pursue a platform of dharma, then we have this question, will dharma save us and all those things. So Madhav, why good hearts suffer more? That like Arjuna is asking Krishna. And Krishna says, because they give without measuring. They trust easily and love deeply. The world often takes advantage of those who mean no harm. Yet remember, a pure heart may break, but it never loses its light. It's very, very important. To get a pure heart is the greatest blessing that Krishna can give us. Any 1 second we can deviate from our pathway and the whole Janma can be lost. Transiently, we may think we are winners, but really we are losers. So if that doesn't happen, whatever may be the suffering, we will remember a pure heart may break, but never loses its light. It will show light from some angle to someone, and that is the purpose of life. So we will start with our hands. So hands, what truly are, as we know that the homunculus for the hand is next to the brain. So that is the biggest homunculus. So anatomy, mudras, hand dominance, some disorders, some common things, some less common things, some queries like that, we will cover this topic. So this is the motor homunculus. You can see that brain is here and hand is here. Almost both are having the same representation. And the rest is having very less representation only. And there is mild difference between the motor homunculus and the sensory homunculus. Some time back, I have put it in the early introduction where the hand, leg, everything. That part we will not go into. Here what we are thinking is head, brain and hand. They are having the largest representation and minor difference in the motor homunculus and sensory. Here you can see motor head is like this, hand is like this, whereas sensory, there is little more dominance for the thumb. Of course, thumb is dominant in the motor also, but here little more dominant, and the plane of the head is sagittal. So this is a sensory homunculus. The leg also, there is a difference. Based on that, we differentiate cerebral paraplegia from spinal paraplegia, which I have put in some other talk. Here the purpose is different. So we will see that the sensory homunculus also, hand is as big as the head. So it is like this. The homunculus contains a very big head and the rest of it is small and the hands are big. So that indicates the importance of the hand. So hand is as important as our brain. So we have got representations for the hand. The dorsal part of the hand has got a different representation and the ventral part has got a different representation in the precentral and the postcentral gyrus. And there are a lot of other linking for finer actions that we do with our hand that I will be covering in the subsequent slides. So the motor and the sensory, dorsal and the ventral has got fine representation for different parts of the hand in the cerebral cortex. That is the anatomical connectivity. Sensory, motor we went through. Functional connectivity, you can see the thumb is, we saw the victory sign, the failure sign, so many gestures by which we communicate with each other. So this is for the executive function. So that mainly we use the thumb. We don't use winner sign and other signs with the little finger. We do it with the thumb. So thumb is linked to the prefrontal cortex. That's the executive function carrying out area. And this conceptual part, index, we point and tell, don't do this, no, that kind of thing. So conceptual function is in the index finger. And the somatosensory function, that is a very important finger. We will see some other unique features for the middle finger later. So this is middle finger linked to the parietal lobe. And we have got the ring finger that is linked to memory. We use a marriage wing and other some important things in the ring finger, saying that it produces a lasting link, lasting memory with the heart, like that people used to tell. So in fact, the ring finger has got lot of connection with the temporal lobe, so sentimental memory, so that certain things are made very strong. And the little finger is having linked to the occipital lobe. So this is the functional connectivity. Thumb to the prefrontal, then the index finger to the postfrontal, then the middle finger to the parietal lobe, and the ring finger to the temporal lobe, and the little finger to the occipital lobe. So and here this is an MRI. We see this is the hand knob area. In the post-central gyrus, you can see this can easily identify in our usual MR imaging that we do. So that is about the higher representation. Then we have got the muscles at the end, which is the end organ. From the cortex, all these connections, and finally the function is carried out by the body limb. We have got muscles, thenar, hypothenar, lumbrical, intraossei, palmaris, brevis. And this is for a small revision. We have got 4 dorsal intraossei and 3 palmar intraossei. And the middle finger does not have a palmar intraossei. But dorsal intraossei, 2 of them are connected to the middle finger. So that is unique. There are only 7 intraossei, and middle finger has no palmar intraossei, but it is having 2 dorsal intraossei, so that it abducts on either side. And so hand is a very important organ. That is why our ancestors wrote this mantra, Karagre Vasade Lakshmi. Morning when you get up, only look at your hand, worship and come out, and then touch the Bhuma Devi and thank Mother Earth for allowing us to walk like that. That is our customary life in the ancient Sanatana Dharma bound India. So Karagre Vasade Lakshmi, Karamadye Saraswati, Karamule Sthida Gauri, Prabhade Karadarshanam. So this is written several thousand years ago by our great forefathers. And we tell Namaste with our hands, no? That is called Anjali Mudra. Namaha. Namaste is Namaha De. I bow down the divinity in me to the divinity in you. That is the foundation of this Anjali Mudra, by which we greet our loved ones, friends, seniors, Swamijis, no? So Namaha De, I bow down the divinity in me to the divinity in you. That is the meaning of this mutra. Namaste, Tattvamasi, thou art that. That is actually the divinity is there in both of us. So thou art. Chandyoga Upanishad found in Samaveda, and the Mahavagya. What is a Mahavagya? Is the great sayings in Hindu philosophy, represents the unity of the individual self, Atman, with the universal consciousness, the Brahman. And the phrase is part of a dialogue where the teacher Udalaga instructs his son Svedagedu about the nature of reality and the divine. So we have got some other representations apart from the anatomy, physiology, muscles, which I briefly went through. The brachial plexus part in between I didn't cover because that is done last time. So the celestial representations, middle finger is called Saturn. The pattern and the planet of karma, discipline, responsibility, and limitation. The ring finger is Suryan, the king planet, which represents the soul. That is why it connects, so many functions are linked to the ring finger. The little finger or Buddhan is intelligence, communication, speech, and analytical skills and logical thinking. Buddhan is the planet linked to the little finger. And index finger is the most auspicious, Guru. Index finger is Guru, the most auspicious. So you indicate, point, a lot of gestural communications are carried out through the index finger. Thumb is Chukran. Chukran is love, luxury, and beauty. So these are the celestial representations of the various fingers. Then we also have this kind of depictions that 5 gunas, tamas, rajas, sattva, jivatma, and paramatma. All these 5 tattvas also represented using the 5 fingers. Then mudras, we use lot of mudras, that is a gestural communication, non-dominant hemisphere function. Gestures add a spatial or imagistic component to spoken language. So gesture conveys much more things than what we convey with our language. Since gestures are not confined to the linear, rule-based method of the spoken language, they have the potential to express ideas which may be difficult to convey by words. So that is the complexity of the motor functions of the hands. So mudras are masterpiece of nature, spiritual and artistic traditions, and therefore sacred. They are the language of the wilderness, whereas the acquired language is our spoken language. So Indian rishis found a direct relationship between the Panchamaha Buddhas and the fingers. That I have grossly mentioned from different attributes, that with very limited knowledge in our ancient scriptures, and unfortunately I could not have access to any of this. So still what little I know, I thought I will share with my younger colleagues. And hands are source of tremendous power. That is why the mudras convey innumerable meaning. Dexterity, sensitivity, utility, and it can heal or harm. You were very much, as doctors, we know about the healing touch, of the healing touch. And the other way also, it can harm also. And touch conveys an array of thoughts, feelings, and intentions. And this is taken from the book Mudras of India by Kane Carroll and Revital Carroll. So then yoga tattvas, which are also represented in the fingers according to our scriptures. Thumb is Agni, index finger is Vayu, middle finger is Agasha. That's the most powerful. And the ring finger is earth, and the little finger is water. So there are several mudras. I am not at all the person to talk about this. There will be big scholars. I just mentioned the skeletal thing which I have referred. Gayatri mudras, we have got 24 pre-mediation, that is before starting, and 8 post-mediation, that is at the end. These mudras represent Dasavadara. So we have got mudras to represent many things. So starting mudras 24, ending mudras 8, and mudras to represent Dasavadara, mudras to represent Navagrahas, the various gods, the 4 varnas, various relationship, and we have got mudras with one hand, both hands, alternating hands. So that kind of several innumerable combinations by which across, India is a country with so many languages. So if you want to demonstrate or speak anything, it is very difficult. Whereas this kind of gestures has no verbal language, so everybody can understand. So this is another way of universal communication. So this is a pre-mediation or the starting mudras. They are called Anjali mudras. So if these signs are shown, that function is starting. And at the end, these are shown that the function has ended. So some samples I have just shown. So if you know, we can understand what the presenter is saying. Then we have got palmistry. I just beginning to read the signs of palmistry. And all of us know that the simian crease. Simian crease is an indicator of Down syndrome, the Nakashi syndrome, fetal alcohol syndrome, and many other things are there. The worlds and all those things are associated with some diseases, which I will read and do it in another session. So how we learned? So now we have seen the anatomy, physiology, philosophy, and spirituality in brief about our hands. So how we learn to use our hands? Infancy and childhood, the infants first learns basic hand skill like grasping and bringing objects close to their mouth. That is the function that the newborn needs. So the infants first learn by grasping and bringing objects close to their mouth. And then they repeatedly practice this. If they have to catch a toy or bring their milk to their mouth, they have to use it. So they repeatedly do the action, perfect that motor skill. So through repeated action, our brain learns the coordination needed for specific hand movements. So even though this is the initial movement, so many other movements slowly are learned by imitation and by bottom-up processing. So many networks are produced, and then it becomes a top-down effect later. And functional training to improve hand function, we should engage in exercises and that mimic the real life activities such as writing, opening doors, cleaning. These are learned activities. So slowly, initially it is the function related activities which are learned and perfected, and later slowly many other activities are learned. And fine motor skill development, specific exercises like gently lifting fingers off a table or using a soft ball, they all improve the dexterity. So after the crude skill, the child learns fine skills. And later, by about 8 months of postnatal period, child develops bilateral coordination and learns to shift one object from one hand to another, learning to use both hands together on a task such as use of scissors, and other skills develop slowly after the 8th month of birth. Then calculating. So we know the just man syndrome, finger agnosia and acalculia. How is the number related to the finger? Because across the cultures, all over the world, people learn counting with the fingers. That is how fingers are related to the calculation, and angular gyrus is having a coordination between the finger and the mathematics. And when that goes, we get the just man syndrome with acalculia and finger agnosia. Then we have to use our hands for writing, make this gestural communication, self-mutilating or self-protecting, creative activities, then self-harming, alien hand behaviors, then useless hands and useless hands of Rett syndrome. All these are in the health and disease, what happens to our hands. So that is a brief introduction into the anatomy, spirituality, philosophy, and ancient Indian wisdom on the most important organ next to the brain, that is our hands. Now we will go to the smaller aspects. This is the classical boat-shaped deformity in the thenar region. That is carpal tunnel syndrome. Typical boat-shaped deformity due to the severe wasting of the abductor pollicis brevis or due to carpal tunnel syndrome. So we will do this small exercise, and this is a phalanx test. We can do this way, or you can also do the extension, hyperextension, and this will bring out the symptom of carpal tunnel syndrome in 1 to 2 minutes. So this is carpal tunnel syndrome. This is a kind of cottage industry in the waterlogged areas of Kerala, Alappuzha, where this coconut husk is converted into coir, where children to adults, they start doing this work. So we found when I came from Chennai and started working in Alleppey for the first time, I saw people with foot drop and median nerve palsy of unknown etiology. And people did not know why this is happening in this place. All investigations were negative. It was a very rural medical college where nothing was there at that time. Then I went into the cottage industry, and I found out people sit with alternate legs crossed for several hours and rubbing these hands like this. And we did work on asymptomatic care workers. Children, they start by the age of 8 or 9 and go on till their end. And we brought asymptomatic person, did electrophysiology that was available in that medical college, and first time described the care workers neuropathy. And this was published in the Annals of the Indian Academy of Neurology. Then we have got the clawing. This is a complete clawing. When the clawing affects all the fingers, it is called complete clawing. When there is a nerve pattern It is called partial clawing. So this is a complete clawing which we see in motor neuron disease. And this is a split hand sign due to the selectivity of the muscles involved. This kind of a deep groove occurs in the hand, that is called as split hand in ALS. Split hand sign in ALS. This is a finger drop. We know that these 1.5 fingers belong to the median nerve, and these 3.5 fingers belong to the ulnar nerve. But a single finger, which is neither in the median nerve nor in the ulnar nerve territory, drops. That is the anterior horn cell pattern. This is a dropped finger sign in motor neuron disease, because here it is the motor unit, not the nerve that gets degenerated. It is the McCormack motor neuron theory. Based on that, it is a motor unit. So there will be a non-nerve pattern of wasting and weakness. So this is finger drop sign in MND. This is a trans-territorial. One finger in the ulnar nerve distribution and another in the median distribution. So that is a cross-territorial feature that does not respect the nerves or the root. So this is also another feature in motor neuron disease that gives a bizarre appearance to the hand. And here we see the subtle pyramidal sign. This is called finger sign of Shokyo. So when there is a very subtle motor deficit, we have got some methods: slow pronator sign, finger sign of Shokyo, melting sign, like that we say. So this is the finger sign of Shokyo. He's not having great weakness, so that is not manifest. So when we examine patient says, I am feeling slightly weak, and you don't find anything, before that we should look for subtle features. So that will help us not to miss a case. So this is a sign of subtle pyramidal involvement called finger sign of Shokyo. Here you can see that the finger is normal. And this is a incurved little finger, which is seen in Down syndrome. This is a genetically confirmed chromosomal confirmed Down syndrome. So this is incurved little finger. And myotonia. You can see when you tap, the fingers remain in spasm for longer time. And this is a clawing in Hansen's disease. So unlike the clawing in motor neuron disease, where the bony architecture is normal, here there is an autonomic dysfunction. So there is these clawed hands of patient with Hansen's disease shows the ice cone bones. The clawing with ice cone bones is bone resorption, which is typical of Hansen's disease. And here we see fecomelia, thalidomide and other neurotoxic agents, intrauterine bands. So that results in a fecomelia. Here you can see somebody is telling us when they reach the teenage that they find that one half is weak. It might have been there long back, but with that age, when we start looking at our body constitutions, we suddenly realize. And one thing that helps us is the nail and the fingers. You can see that this thumb is bigger, this is smaller. That means it is a very long duration thing. It is not a new one, but patient is carefully looking at himself or herself, and they identify and tell us that this has happened only few months back. It was not at all there before. They will come and tell us. And by comparing the nail and the size of the fingers, we know that it is a HHE thumb sign, hemiplegia, hemiatrophy, epilepsy syndrome. The thumbs help us to say it's a old thing clinically. And this is a finger drop without wrist drop. That is seen in posterior interosseous nerve palsy, finger drop without wrist drop. And this is a slow pronator sign. The finger sign of Shokyo is a subtle pyramidal sign. Similarly, slow pronator sign. The patient keeps the hands extended, outstretched, and slowly the side on which the pyramidal deficit is there will pronate. That's a slow pronator sign. Then we have right as cramp. So we have some the common examples, and this is a right as cramp. Several types are there. You can look at the way the index finger is pressing and going on flexing when the patient is holding the pen. It's not the way we hold our pens. And they have to lift it up several times. So the writing time increases, writing speed reduces. Those patients become disabled. This is a focal dystonia, writer's cramp. Slowly we can see how the finger goes into various postures. This is a surgeon.
Yes. Yes.
So this is not playing, unfortunately. This is a cardiothoracic surgeon, and his thumb, this is an occupational cramp. He's a pediatric cardiologist, operating for several years, and just like me, he also have no recreation. He doesn't know any other recreational activity, and he suddenly found that his thumb is revolting, and it is going under. This is on, it's not in the theater. It is in our office room. Similar thing happens when he is trying to calibrate into the various parts of the newborn heart. Somehow he is slightly better now, but this is a occupational cramp in a surgeon. The video is not playing, so I am not playing somehow. So this is a very peculiar way where the thumb goes under. So he says that it does like that, and like an alien hand, the thumb revolves when he is stitching up the heart. So, but with some medicines, yoga, meditation, and great spiritual energizing, this surgeon has started operating again. This is an autistic child who keeps on plucking out the skin from his scalp. So it's a self-harming hand. He will keep on, even though it is producing ulceration, which are very difficult for the persons to watch. He's going on injuring himself. So this is hemibalismus. All of us know all this, but simply I thought what all things can happen at the lower level in the hand and higher level in the hand. So this is hemibalismus. This is a mirror movement. So whenever he does anything with the right hand, the left hand also does it. It is a case of infantile hemiplegia. This happens usually due to either abnormal pyramidal crossing by birth or acquired corpus callosum thinning following early hemiplegias, where the proportion between the crossed and the uncrossed pyramidal tract becomes altered. So this boy is from a Tamil village, and they first noticed it when he was going to deliver milk bottles to the neighbors. They have cows in their house, and when he gives the first bottle, the opposite hand automatically drops that milk. So initially they didn't know what was happening, and this was the cause, the mirror movement. When one hand is moving, the opposite hand automatically does the same. This is another person who has the same mirror movement, but she has grown up. She has a hemiplegia on the left side with mirror movements. This is the classical pill rolling tremor, classical pill rolling tremor of Parkinsonism. Classical pill rolling, not always seen. So it's a classical pill rolling tremor of Parkinsonism. And one of the features to say whether a Parkinson is idiopathic Parkinsonism or atypical Parkinsonism, which is of diagnostic and prognostic relevance, is re-emergent tremor. Now the person has achieved another posture, then there is no tremor, and slowly after that hand stabilizes on that position, the tremor comes back. This is called re-emergent tremor. That is indicating that this is a good PD. So this is a re-emergent tremor. This is a patient with CBD, levitation. He keeps the hand in without any purpose, without any reason. He keeps this hand like this. So that is levitation, abnormal posturing seen in CBD. This is the shock like myoclonic jerks seen in metabolic dysfunction. Many polymyoclonus. This is a patient with the corticobasal degeneration where there is stimulus sensitive myoclonus in the right upper limb. So this is a stimulus sensitive myoclonus in CBD patient. This is Rett syndrome where the hands go into stereotyped continuous activity so that they cannot use their hands to for the purpose it is meant. Rett syndrome. It's an X-linked dominant disease. So it is not compatible with the life of males, male fetus, but rarely males also present with the Rett syndrome, very, very rare. Other case, any number of patients we see. Because of these movements, they are unable to use their hands. But one interesting thing we saw recently, so these children who are unable to use their hands undergo special therapy and somehow they learn to use their hands for feeding, combing and some daily activities. And interestingly, we saw a few children who write in a very strange way. The child will write if she can hook to the little finger of her mother. She is only writing. But if you remove that little finger of the mother away, she cannot write. So what is the sensory trick or what is happening, I don't know. But I have now collected some children like this and I am trying to find out what mother's touch is doing to motor activity. So she's only hooking her little finger to her mother's finger. But if that is removed, she will not write. So it's not the only child. I have seen 2-3 children like that now. So Rett syndrome is purposeful hand use is lost because of the gene mutation, which disrupts brain development, leading to a progressive neurological disorder characterized by loss of skills and language, including the ability to control hand movements. This loss results in stereotyped repetitive hand movements, replacing the functional grasp and reach and severely impairing the activities with the hand. And this initially the person called Alexander Rett, he found that some of his patients who were diagnosed as cerebral palsy were having this kind of movement. Unlike the general cerebral palsy children who will have multiple movements and each one will have a unique movement, these children, we are having the same kind of movement in all the children. So he described that as a unique movement disorder in children with cerebral palsy. That is Alexander Rett. Then postmortem was done in the brains of these children, and a person called Sakubai Naidu, who is one of the earliest graduates from Madras Medical College. She is a contemporary pathologist, very senior person, and she did the postmortem, and she was surprised to find that the neuron number per field is very high in these children. But what happens is they are not connected. So because they are, even though the neuron number is high, as they are not connected, they are ineffective. So unity is strength. So she described it as a synaptogenetic disorder, where the synapses are not there. Therefore, high neuronal count and less function. That was the Sakubai Naidu madam's pathological observation, and later the gene was identified. So all this happens because of the gene mutation. So this I have shown already. This is also, this child also writes in a different way. That child was holding to the mother's little finger. And this child, the mother has to keep her hand over her hand. Then she will write. So it's so curious. So this is a little, so these are questions. How mother's touch can make the child write. The mother has to keep the hand like that. That the child will insist. But who writes is the child only. She is only writing. But the mother has to keep her hand. So I don't know the mechanism underlying this, but search for answers. So action tremor, some horizontal component also. This is a rubral tremor. So this is a Lesch-Nyhan syndrome, self-mutilating. He is by injuring, biting his fingers, biting his lips. No? So when they mutilate their fingers, they hit and break, they don't realize the pain. That's the next group of disorders of harmful hands. They are harmful hands. No? Hypoxanthine, guanine, phosphoribosyl transferase deficiency, where xanthine and hypoxanthine became acted upon by xanthine oxidase, converted into uric acid, resulting in gout. But in the brain, there is no xanthine oxidase. So in the brain, there is deficiency of xanthine, hypoxanthine. There is excess of xanthine, hypoxanthine, and deficiency of the inosine and guanine, resulting in a peculiar syndrome of self-mutilation to maintain the flow through the ARS. That is the postulate. And then hyperapraxia. They are long loop reflex syndromes, jumping Frenchman. No? So I could not get that X-rays. My own patient, I have published that. I think that picture is in the publication. Unfortunately, I could not get that picture from my picture structure. A peculiar hand with the increased space between fingers and between metacarpals. It's a peculiar shape, it a flailed out hand. So we have published a hand in this Journal of Pediatric Neuroscience long back. Unfortunately, I am not able to get that X-ray. This is a Pullister-Hall syndrome. It's a hypothalamic syndrome with multiple anomalies, short philtrum, polydactyly, hypothalamic tumor. No? This was also published, and they have polydactyly. It's a genetic syndrome called Pullister-Hall syndrome. No? Where one, unlike Lawrence-Moonbill-Diddle syndrome, this also has polydactyly, but they have got a tumor here. Then what is this Jesman syndrome? They have finger agnosia, acalculia. I just mentioned that fingers and mathematics are connected across the cultures. Everywhere people use the fingers to calculate. And in addition, all the features we know, right, left disorientation, agraphia, semantic aphasia, lesion is in the angular gyrus. So angular gyrus has got a key role in higher order cognitive function by integrating somatic information and is involved in language processing, reading and writing, number processing, semantic understanding, and spatial cognition. So it's a very important structure with a lot of connections. So the various structures which connect to the angular gyrus and integrates most memory, sensation, motor function, mathematics. So it's a very important structure, and that causes finger agnosia. And this is another no, this is the same child only. So is it a sensory trick? And what is mother's touch doing to child's writing center? That's a question which needs a brainstorming to find out the answer. And this is another child, very, very wonderful child. He has not learned languages. He depends on his mother, but he has, it is like a Durya state, or whether he is Adi Shankara, we don't know. He has written so many books and he gives answers in unimaginable linguistic skill in English, Hindi, and other languages. But otherwise, he is a child who doesn't speak, doesn't have eye contact, and he doesn't communicate with us. He has the screams and other behavioral issue. But when the mother puts her hand on his hand, he becomes a genius. And his books and poems are already published, all written like this. Where is this coming? He never learned any of these languages. He is undergoing therapy for his daily functioning. But how he wrote all this? So when all the end organs are shut, whether the child is in Durya state and direct flow of universal information to his brain, so he writes these books. I don't know. So these are questions we have to ask. So mother's touch is a mix of biological, hormonal, psychological, protector instinct, unique, instinctual bond, nurturing in complete surrender. So a child completely surrenders physically, biologically, psychologically, hormonally. So what kind of this link is producing the skill in a child who is otherwise apparently needs help for basic functioning? We don't know. So representing unconditional, unjudgmental acceptance with security and self-worth. This noble bondage established at conception in deep selflessness, support, and is a spiritual link. And this link is making the hands work and create poet. That boy has published books, but he cannot utter normal communication. So how this is happening, we don't know. So we are in search of answers for this. So it's the different writing area in the brain which is activated with a trainer or mother, we don't know. Does the child has all the knowledge as if in Durya state, or is it a sensory trick? We don't know. So this is another hand trajectory apraxia. So if this person has to this person has got apraxia of eyelid opening and trajectory apraxia. So when we tell him to bring the hand down from his usual position, he will lift his hand above the head, bend his trunk, and then bring the hand down. And so that is a hand trajectory. How to move the hand to bring it down from his sitting posture. He goes through a circuitous route, motor planning defect. It's a trajectory apraxia due to failed motor plan acting on hand movement. So this is a ideational apraxia.
రాజగోపాల్ గారు కొవ్వొత్తు వెలిగించాలి, కొవ్వొత్తు వెలిగించాలి. ఇది ఎక్కడ ఉంది? కొవ్వొత్తు ఎక్కడ ఉంది? ఎక్కడ ఉంది? వెలిగించండి. దాన్ని ముట్టి ఎందుకు
So loss of like functional connection with objects. Which object are used for writing? So that is an ideational apraxia. This is a person with a diagnostic apraxia. So this girl initially when she was studying, she felt that her left hand is pushing her book out. She didn't know what is happening, and so she was thought to be possessed by some bad energy forces which are preventing her from studying. So she was taken to those kind of practitioners, which was not better. Then she found that when she's eating or anything, when the right hand is doing something, the left hand will push it out. And she had a lesion on the non-dominant angular gyrus, which was a cavernoma. And this is a diagnostic apraxia. So later, nobody dared to operate that, because otherwise she is not having any problem except this opposite action by the left hand. So later she trained herself to sit on her left hand when she is eating or she is reading, so that the left hand doesn't play mischief. This is a focal partial seizure, focal partial seizure, not an uncommon thing. This person has been told to keep his hands like his son. Then he is saying that this fellow will not cooperate with me. So he's a case of CBD. He says that this fellow won't cooperate with me. Then he goes through a different trajectory and brings the hand to the posture demonstrated by his son.
Somebody calling was calling well, and if I take the moon, it will take more time. I was seeing the left hand is coming over there. Give him some telling to operate in this. The right hand is sometimes Mudra moments we are coming as because we saw. Sometimes. That's a he has to put his mind in. Slide. It's not the one thing. Now all of you are looking at me. Why excitement? Suppose somebody calling was calling well, and if I want to take the moon, it will take more time. I was seeing the left hand is coming over there. You are you banner with the telling to operate in this. Sometimes when whether you can imitate it. Record
Just to capture and bring the hand to that position by doing many other motor activities. She's saying the hand is not coming.
Yes, I've done in 6 to 3 days. On this time it was.
അതേപോലെ മോൻ വെച്ചിരിക്കുന്ന പൊസിഷൻ കണ്ടില്ലേ അതേപോലെ വെക്കാൻ ശ്രമിച്ചു. Very good. So he has to forcibly capture.
But I have to make like this and time.
So he's saying that he has to go through a different trajectory and capture. Then we have got persons who do creative work with their hands. In various dementias, we have identified people who are restless, aggressive, agitated. You keep them a pen and pencil, and who have never learned art before, who are not known artists, they become very quiet. It is a pharmacosparing agent in some of our patients who learn to be creative. This is a teacher who designed a cap which will detect when the person sleeps while driving, and then she rapidly deteriorated to frontotemporal dementia and she is no more. So this is creativity which is artistic, or this is another person who drew all these, and he has donated these pictures. His son has donated these pictures to the NIMHANS museum. Such beautiful, he is not a person who is an artist who either learned it or practiced it. And this is their MRI showing bifrontal atrophy. And this we have published in the Annals of the Indian Academy of Neurology, how creativity happens in the degenerative brain. Complex pictures drawn by a engineering graduate who suffered from advanced neurosarcoidosis. And so he drew all this when he was put in the backbench by the company. This is his MRI. And these are the FMRI work we did on these patients, and found out some enhanced connectivity between the angular gyrus and the prefrontal region in these patients who became creative halfway through their degeneration. Next is hand dominance. We know handedness goes with tiredness. Then various hand uses, that is by the Edinburgh's handedness inventory. The reflex uses we will ask and find out. Then you have got EEG, FMRI, and Ametal test. So this EEG shows left side having a very well-formed alpha. So non-relaxing hemisphere is the non-dominant hemisphere. Better alpha is non-dominant. Relatively less better alpha is dominant because it is an active side. And you have got mirror writing, is writing in opposite direction to normal with individual letters reversed, so that it is mostly read with a mirror. This is seen when left hand person is left hand is called into action. So these are something, a lot remains. I thought I was moved by this mother's touch writing. So I thought I will study something about the hand, and I have shared it with all of you. So like everything in God's creation, hands are wonderful and they are next to the brain. How they lose function in some diseases, how your mother's touch pours immense knowledge in special children, and how a degenerating brain makes hands creative. All these are unanswered questions which the next generation has to pursue. And so this for the new year, Asatama Sadgame, Damasoma Jyotirgame, Mrityama Amardam Gamaya, and let there be Shanti. So Dharma is a cosmic law underlying right behavior and social order. Truth may seem to cost everything temporarily, but ultimately, we can, if we lose in this world, it is worth rather than losing our pure self. Many times when from early times, from what I learned from my parents and my teachers, I have always taught our students that medicine is a very divine science and it is not a profession, and we should be altruistic and do our best so that our janma becomes liberated and becomes punya. But of late, increasing violence and cruelty to our younger colleagues and our own selves, we also suffer every day. Whether I should teach my children like that, I always ask myself. But I still feel that truth may seem to cost everything temporarily. But ultimately, if we lose in this world, it's worth. It is worth rather than losing our pure self. So even though we may suffer in the practice of dharma with people around us who do not understand, it is still worth not to lose our pure self and remain ourselves, whatever may be the situation still. So that is the message I wish to tell, because we have seen one hand and it is only a one small drop of what I started looking at after I got interested in the mother's touch related handwriting. And then so much information is there. Yes, see, a very small percentage I have shared. So this is a different thing. It is not like the way hit to kill kind of low level intellectual persons functioning. Let them do what they want. We will be ourselves. So any amount of suffering is okay, but it is not worth losing our pure self. That is the most important thing for us. Let us be ourselves and not lose ourselves to the terrorized world, which will learn its lesson slowly. So thank you.